Hi guys, Paul Haas, physiotherapist. Today we're going to go through the ankle taping technique. Have you had your ankle taped before, Georgia?
I have.
Game on. Today we are doing it again, and we're not doing the traditional taping technique that most of you people will be used to. We're going to mix things up a bit today, try and show you a bit of a novel technique that one, uses less tape, and two, uses tape properties as they should. So tape likes skin, but tape loves tape. So we're going to show you exactly the principles behind why we do a slightly different technique around the ankle. So here we go with our ankle taping technique. The technique today is not like what you would normally see when you're looking at other type of videos. This is pretty much a special technique we've developed based on the real properties of tape, which is being the glue tape loves tape almost more than it loves skin. So let's go through the technique. Okay, first of all, in any technique you do, you need to protect certain structures, and tendons are those structures. So we apply a bit of protective fix-it tape to the tendons of the tibialis anterior and behind the very large Achilles tendon. So we protect those two areas with fixed tape, which is a hypoallergenic tape. Gives a bit of stretch and just protects those structures. Okay. Now, one thing that remains the same is our anchors. So we go from plantar flexion in a dorsiflexion position, so we've got a nice 90-degree angle, and that's really important for the stability of the ankle when you're doing this taping technique. Okay, so we apply one or two traditional stirrups, we call them stirrups, but to the purpose of today's taping, we're going to call them anchors. So these are anchors. So pop your foot up again for me to that dorsal. That's it, plantar grade position. Okay, so you can apply one or two of these stirrups, but as I said, we call them anchors for the purpose of our taping technique. Okay, now what we do is tape loves tape. Okay, so what we do is we start with a fixed point at the bottom of the heel. Okay, so and then we come around and we apply the tape up and we fix it to our top anchor, and we're going to apply two or three of these. So you'll notice with this technique that I do not put a lot of tension on the taping technique, because rigid tape, you don't need to apply it any firmer than just a little bit of tension, because you'll start to jam up the joint, and that's not what we're trying to achieve. So I've applied two, and you can apply three. The nice thing about this technique is that if you start your tape from the bottom, you have a nice ability to move the tape to the position that works for you and works for your patient. Okay, so we've got three on the inside, and then on the outside we apply three as well. And with the outside, again, it's really important that we don't put excessive tension on the actual tape when we're applying it. Okay, so we just apply the tape, and you can apply two or three of these, and again you can control the position where you want to pop the tape. Okay, so. And the neat thing about this is, different to the traditional technique, is that we actually are starting from the bottom, which means that we don't have to worry about the tape going all the way around, which can start to twist, and the tape starts to fold back on itself. So this is a nice way of doing it, where it's nice and clean and neat, and you have more control when you're taping. Okay, so from there we've applied our stirrups on the inside and on the outside, so medial and lateral. We've got nice control of the ankle. Now another taping technique we'll add on top of these stirrups is our heel lock. Now with the heel lock, you can use a 38mm strapping tape or strap it 50mm, just depending on the size of the athlete. Okay, so what we do is we start from the top here, and you go over the medial malleolus, which is the bumpy bit on the inside of the ankle. Okay, we come around at an oblique angle, so this is the tape coming around with a little bit of tension, and we're effectively coming back around the medial side back to where we started. Okay, so you have the option there to rip the tape, which I prefer to do, or you can continue down around the outside. Okay, and then we've got our heel lock starting lateral, coming around the lateral malleolus behind the Achilles. Important not to put too much tension on the Achilles, because we don't want to cause any tendonitis or tendinopathy because of compression on the Achilles. So we come around and again back to where we started. Okay, so that's our heel lock. Now, if you want to control the midfoot, so some of the ligaments here, such as the bifurcate ligament complex, you could use another ankle taping technique which effectively supports this medial area. Okay, so I'll quickly show that one as well. And what I'd start with is a bit of tape that goes along the bottom of the foot. Okay, so along the metatarsal heads, and we come around and we don't apply too much tension here. We just lay the tape down. Okay, because if you apply tension, you'll squeeze the foot and you'll cause irritation between these metatarsals. So that's just applied gently. And now we just ask the patient again just to come into that plantar position. Now from here what we do is we apply tape to our most distal point, and then we come along and we rip the tape, and what we do is we use the thumb on the distal aspect and we put some pressure. So with the you can see here my fingers behind the Achilles, and we apply tension from our fingers into the calcaneum, and we pull back and we apply that pressure. And once we've stuck the tape, you'll see here I've let go, so my tension's through here, not through here, because I'll apply that gently around the back, which is important so I don't put pressure on that Achilles. Okay, so it's really important. Now in a basket weave taping, what we would do is we would apply one of these at a time that we did earlier, and apply one of these. Apply one and apply one. So I'm demonstrating this on its own, but you can do it in conjunction with the first taping technique, just like a basket weave technique. Okay, so the second tape here again, apply that pressure and stop there, and then you just roll the tape behind, so no further pressure after that. And we'll just do one more. That's it, the patient has learned that we go into plantar. Okay, same thing, so apply the tape, and this one you can do a little bit more proximal. Pressure around the calcaneum, no more pressure, lay the tape down. Okay, so from there what you need to do is lock off your anchor. So we come around here again, just like before, no excessive pressure, so just lay that down. Okay, and we do our final lock off up top. So you can have one anchor or two. And that's a fantastic taping technique. So nice stability through the rear foot and also through the midfoot here, which gives you optimal control without excessive tension. It's important after you've done basic ankle strapping with the rigid tape is to, in our opinion, is to apply additional overwrap, so a compressive type of support, which supports the ankle. And especially the athlete or the patient does give feedback that the additional support provides compression, and things like proprioception may be enhanced. We're not sure, but certainly we're trying to improve those things. Okay, so the technique. So start at the top. We come around. You can see I've already advanced the tape, and we're following this technique just like the what we did for the heel lock. So we follow that effectively that same path. So come around the back. We don't apply really any excessive tension here. So we're using our 75mm stretch band light. You can also use our 75mm stretch band plus or stretch band heavy, depending on what you're trying to achieve, and also what you've got in the cupboard. So continue that way. Come around. Again, advance the tape as I've done before. You don't want too much compression here. Okay, we come back along the similar line. Try to avoid any creases in your taping technique. Advance the tape and finish up at the top. And the beauty of this tape is it rips. Now sometimes what we do is we like to finish off our technique just with a bit of rigid tape for this type of stretch band light. So there we go, folks. We've got a combination of our rigid tape, anchors, stirrups, slightly modified technique where we start the tape from the bottom for better guidance rather than doing full stirrups and sixes, which causes a bit more of a mess. And we finish off with a nice compressive type bandage for further support, compression and proprioception. There it is.